Symptoms of breast cancer. Breast cancer is the commonest cancer in women, with over 1 million women developing breast cancer worldwide every year. While it also affects men, the number is quite small compared to women. In the developed world where records are better kept, it is said that 1 in 9 women is likely to develop breast cancer in her lifetime. Make sure you stay with this video till the end, because a lot of information will be shared. Should you notice the symptoms below, see your doctor immediately. 1. A breast lump. A breast lump is a swelling inside the breast. It is quite common, though most of them are not cancerous. The ones that are not cancerous are smooth when felt, are soft and mobile, whereas the cancerous ones are hard, irregular in shape and not mobile. However, in some cases, cysts which are non-cancerous can be hard and irregular in shape. The non-cancerous breast lumps include what are called fibroadenomas and cysts. The former are common in young women, whereas the latter are found in older women. Sometimes there could be several lumps in one breast. It is therefore important to understand that not every breast lump is cancer. Many women experience lumps due to harmless conditions such as hormonal changes, fluid-filled cysts, infections, or non-cancerous growths as earlier mentioned. These lumps may feel soft or rubbery, may be tender, and sometimes come and go with the menstrual cycle. Some may even appear suddenly and then resolve on their own. A lump that feels harmless can still be serious, and a painful lump can still turn out to be cancer. This is why medical evaluation is essential. Tests such as ultrasound, mammograms, or biopsies are the only reliable way to know the cause of a breast lump. 2. Change in shape of the breast. A breast lump can become attached to the skin of the breast. This and the size of the lump can change the shape of the breast. One breast may begin to look uneven, misshapen, or different from the other, even though it previously looked symmetrical. Unlike normal breast shape changes caused by aging, weight changes, or hormonal fluctuations, cancer-related shape changes are usually new, persistent, and affect only one breast. The situation does not improve on its own and may continue to worsen. Not every breast shape is associated with breast cancer, but recognizing the change early could lead to early detection. 3. Change in the breast skin. Indrawing of the skin of the breast results in a change in the skin of the breast. This could be associated with redness and tenderness of the breast. A change in the skin of the breast can be an important sign of breast cancer, because the disease can affect the skin layers and the lymph vessels just beneath the skin. When cancer cells interfere with normal lymphatic drainage, fluid builds up, leading to visible changes on the surface of the breast. In some cases, the skin may appear red, swollen, or inflamed, and it may feel warm to the touch. These changes can be mistaken for a skin infection, but unlike infections, they often do not improve with antibiotic treatment. The skin may also begin to look puckered, or thickened or discolored, sometimes resembling the texture of an orange peel. This happens because the skin is being pulled inward by underlying tissue changes. However, this situation can also be found in cases of breast infection. 4. The nipple is drawn in. The whole nipple of the breast could be pulled in or retracted or inverted. This could be due to breast cancer, though some other conditions could be responsible. This is more noticeable when cancer develops near or behind the nipple. It can affect the milk ducts and the supporting tissues that normally hold the nipple in its outward position. Suspicion is higher if it affects only one breast. In some cases, the nipple may also look distorted, shifted to one side, or fail to respond to touch or cold the way it used to. There may be other accompanying signs, such as skin changes around the nipple or unusual discharge, which can further raise concern. Any new inward pulling or change in the position of the nipple should be evaluated by a healthcare professional. This can help detect breast cancer at an earlier stage, when treatment is most effective. 5. Breast pain. Breast pain is not common in breast cancer, only associated with about 2% of cases, in a rare form of breast cancer. It is said that most breast pain actually comes from the ribs and muscles. Before being alarmed, please make sure you check properly where the pain is coming from. Breast cancer-related pain could be persistent, localized, or unusual. It often affects one specific area of the breast rather than the whole breast and does not follow the normal pattern of menstrual tenderness. Instead of coming and going with hormonal changes, this type of pain tends to remain over time or gradually worsen. The key message is awareness rather than fear. Any breast pain that feels unusual for you or does not go away should be checked by a healthcare professional immediately. Early attention can make a significant difference in outcomes. 6. Enlargement of the breast. Both breasts are naturally not perfectly the same size, and small differences are normal. However, a new or sudden change in size, especially when it affects only one breast and continues to worsen, should not be ignored. The growth of the lump in the breast increases the size of the breast. However, we must remember that breast infection can also cause breast enlargement. Enlargement of the breast can be a warning sign of breast cancer because cancer can affect how fluid and tissue behave inside the breast. One breast may suddenly become larger, fuller, or swollen compared to the other, even when there has been no weight gain, pregnancy, or hormonal reason to explain the change. This size difference can happen when cancer blocks the lymphatic vessels in the breast. When these vessels are blocked, fluid builds up, causing swelling and making the breast appear bigger. In some cases, the breast may feel heavy, tight, or uncomfortable, even without obvious pain. While this change does not always mean cancer, it is a symptom that requires medical evaluation. Early attention to unexplained breast size changes can lead to earlier diagnosis and better treatment outcomes. 7. Change in the skin of the nipple. The nipple skin could become dry, scaly and itchy. In the case of breast cancer, the problem starts with the nipple and then spreads to the area around the nipple. The nipple may also lose sensitivity or respond differently to touch or temperature. The skin around the nipple, known as the areola, may also change. It can become red, scaly, itchy, or thickened and in some cases may resemble eczema. When these skin changes do not heal with normal treatment, they may be linked to certain types of breast cancer. Early attention to nipple changes can help detect breast cancer at an early stage, when treatment is most effective. 8. Discharge from the nipple. Breast discharge is not uncommon in women and in many cases, normal. However, it could be due to medication or may be due to a tumor in the brain or breast cancer. In the case of breast cancer, the discharge could be persistent and blood-stained and coming from one breast. Presence of blood in the discharge is particularly concerning, even if there is no pain. It is important to understand that not all nipple discharge is caused by cancer. Hormonal imbalances, infections, certain medications, and benign duct conditions can also lead to discharge. However, discharge that is new, spontaneous, persistent or bloody should never be ignored. Any unexplained nipple discharge requires medical evaluation to determine the cause. 9. Swelling in the armpit. A swelling in the armpit may be the first symptom of breast cancer. The breast is drained by lymph vessels which carry clear fluid from the breast tissue to the lymph nodes in the corresponding armpit. The lymph vessels and the lymph nodes form part of the disease-fighting system in the body, fighting against bacteria, cancer cells and other harmful substances by removing them from the body. When the cancer cells reach the lymph nodes of the armpit, they continue to grow, resulting in enlargement of the nodes. Check your armpits for any swelling regularly. Report any swelling to your doctor as quickly as possible. Early detection of breast cancer significantly improves treatment options and survival rates. Women aged above 40 years are advised to do screening by mammogram every 3 years, but it is okay at 50 years and above. The exposure to X-ray is quite harmless and it helps to pick up breast cancer very early. Early detection can save life. Stay informed, stay alive, see you in our next video.